and tricks how to solve MCQs regarding this topic. So today we are going to discuss about the anatomy of the pelvis regarding bones, joints, and muscles, and about the boundaries of the pelvis and the muscles. And I will tell you about the difference between the female and male pelvis. And we will talk about arterial and supply and blood and nerve supply, and the lymphatic supply of the pelvis, because there will be scenarios related to blood supply, nerve supply, or lymphatic drainage. So let's talk about the bony pelvis first. As we already know that bony pelvis is composed of four bones, two hip bones, and two other bones, which are sacrum and coccyx. So the two hip bones form the anterior wall and the lateral wall, and the sacrum and the coccyx forms the posterior wall. So these four bones are lined by muscles and ligaments, and these bones are connected by four joints. So there are four joints in a bony pelvis. So a bony pelvis forms a strong basin shaped structure along with its joints and muscles. And the pelvis has a multiple foraminas through which nerves and vessels passes. And it contains the lower part of alimentary tract and genitourinary tract, such as internal organs of males and females, internal organs of reproductive system, and it protects it. So first talk about the types of joints. As I told you, there are four joints. First joint is pubic symphysis. In our body, there are two symphysis joints. One is symphysis mentae, and the other one is pubic symphysis. So it is a cartilaginous joint, and there is no mobility at this joint possible. The other joint is two joints on the posterolateral sides. These are the two sacroiliac joints between the sacrum and the iliac part of the bone. These are the synovial joints, and there is little or no movement possible at this joint. Posteriorly, another joint between the sacrum and the coccyx, that is sacrococcygeal joint. This is also a cartilaginous joint, and there is no movement possible at this joint. So there are four joints: anteriorly pubic symphysis, posterolaterally two sacroiliac joints, and posteriorly sacrococcygeal joints. So you must remember about the type of joints, as these are very important according to the exam point of view. They will ask you questions regarding the type of joints. So pubic symphysis is a cartilaginous joint, and sacrococcygeal is also a cartilaginous joint, while sacroiliac joints are synovial joints. So pelvis is divided into two parts by a pelvic brim. Above the pelvic brim is the false pelvis or greater pelvis, and which is also a part of abdominal cavity, and abdominal viscera lie in this. Below the brim is the true pelvis or lesser pelvis. We will talk about these two types of pelvis in detail. What is pelvic brim? Pelvic brim is bounded posteriorly by the sacral promontory, as you can see in the picture. This is the sacral promontory. Posteriorly, laterally, it is lined by the iliopectineal lines. Iliopectineal lines laterally, as you can see in the picture, and anteriorly by the pubic symphysis. So it forms a boundary. Posteriorly by the sacral promontory, laterally by the iliopectineal lines, and anteriorly by the pubic symphysis. This is the most important point. So this pelvic brim divides the pelvis into the greater and lesser pelvis. What is true pelvis? True pelvis is a short curved space between the pelvic inlet and the pelvic outlet that contains and protects the lower parts of genitourinary tract and the lower parts of gastrointestinal organ. So true pelvis has inlet and outlet. We'll talk about the boundaries of inlet and outlet. Pelvic inlet boundary is the same as that of the pelvic brim. Anteriorly, it is formed by the pubic symphysis, posteriorly by the sacral promontory, and laterally by the iliopectineal lines. So how pelvic outlet is formed? True pelvic outlet is formed anteriorly by the subpubic arch, posteriorly by the coccyx, and laterally by the ischial tuberosity and sacrotuberous and sacrospinous ligament. These are the ligaments that attaches the bones together and provide support. So outlet is formed anteriorly by the subpubic arch, posteriorly by the coccyx, and laterally by the ischial tuberosity, sacrotuberous, and sacrospinous ligament. So this is shown in the picture. It is anteriorly it is the pubic symphysis, posteriorly coccyx, sacrum, and two joints, and two ligaments, sacrotuberous and sacrospinous ligament, and laterally by the iliopectineal lines. Now, how to differentiate female pelvis and the male pelvis? There are a few points that can differentiate between the female and male pelvis. In females, the pelvic cavity is broader and shallow as it is designed according to the vaginal delivery. And in males, the cavity is narrow and deep, and it is in females it is oval in shape. Pelvic inlet is oval in shape, and in males it is heart shaped. Pelvic inlet is heart shaped. In females, pelvic outlet is round and broad, and in males, pelvic outlet is narrow. In females, bones are lighter and thinner, and in males, bones are heavy and thicker. Subpubic angle is larger in females and acute in males. Coccyx is more flexible and straightener in females, and it is less flexible and more curved in males. Ischial tuberosities are shorter and more everted in females to promote the vaginal delivery, and in males, ischial tuberosities are longer and face more medially. So, in females, cavity is broader and shallow, pelvic inlet is oval in shape, bones are lighter and thinner, subpubic angle is larger, coccyx is more flexible and straighter, ischial tuberosities are shorter and more everted, while in males, cavity is narrow and deep, inlet is heart shaped, outlet is narrow, bones are heavier and thicker, pubic angle is more acute, coccyx is less flexible and more curved, and ischial tuberosities are longer and face medially. Let's talk about the walls of pelvis, anterior, posterior, and lateral walls, and floor. So anterior wall, as I told you, formed by the pubic symphysis and the pubic rami, as shown in the picture. Posterior wall is formed by the sacrum, coccyx, piriformis muscle, and its covering fascia. Laterally, hip bones, obturator membrane that covers the obturator foramen, obturator internus muscle and its fascia, sacrospinous and sacrotuberous ligament. These form the lateral wall. And floor is formed by the pelvic diaphragm. And floor supports the pelvic viscera, and it is formed by the levator ani muscles that contain three small coccygeus muscles and piriformis, part of piriformis muscle, and the pelvic fascia that covers the levator ani muscle. So this is called the pelvic diaphragm. This diaphragm is incomplete anteriorly, so it allows the passage of urethra and vagina in females. Let's read it again. Anterior wall is formed by the pubic symphysis and pubic rami. Posterior wall is formed by the sacrum, coccyx, and piriformis muscle. Lateral wall is formed by the hip bones, obturator membrane, and obturator muscle, along with its fascia, sacrospinous, and sacrotuberous ligament. And floor is the most important, and it is formed by the pelvic diaphragm. Pelvic diaphragm consists of levator ani muscles, which has three small coccygeus muscles, and the fascia covering it, and it is incomplete anteriorly so that it can allow the passage of urethra and vagina in females. This is the picture. You can see here, posteriorly it is lateral to the sacrum, there is piriformis muscle. Anteriorly, there are the three parts of levator ani muscle. Pubococcygeus, iliococcygeus, and ischio-coccygeus. These are the three parts of levator ani muscle, and this is the anococcygeal ligament that is supporting the anal canal or rectum. And anteriorly, it is deficient and it allows the passage of vagina and urethra. And so this is the superior layer of urogenital fascia that completes this gap. This is the posterior pelvic wall. Here it shows the piriformis muscle from the lateral side, sacrotuberous ligament, sacrospinous ligament, obturator internus muscle, and its fascia. And these are the foramina, which are in the anterior sacral foramina.
Deepane. Mata me BHT stick again of the north porta. May the again of them.
Let's talk about the sacral plexus. It is the nerve supply of the pelvis. So it lies in front of the piriformis muscle on the posterior sacral wall, and it is formed by the anterior emi of L4, L5, S1, S2, S3, and S4. This is the important point in this, that it is formed by the anterior emi of L4, L5, S1, S2, S3, and S4. So it has branches that supply the pelvic structures and the lower limbs. So branches that supply the pelvic structures are pudendal nerve, nerve to piriformis muscle, and the pelvic splanchnic nerves. Pudendal nerve is has root value of S2, S3, and F4. It leaves the pelvis through greater sciatic foramen and enters the perineum through lesser sciatic foramen and supplies the perineum there. Other nerve is nerve to piriformis that supply the piriformis muscle, and the pelvic splanchnic nerves. Pelvic splanchnic nerves are the parasympathetic nerve supply. Its root value is the same as that of the pudendal nerve, S2, S3, and S4. It supplies the visceral pelvic organs. Parasympathetic supply to the visceral pelvic organs. So other branches are that supply the lower limbs. Obturator nerve, its root value is L2, L3, and L4. It supplies the obturator internus muscle and the adductor compartment of the thigh. Always remember, obturator nerve supplies the adductor compartment of the thigh and obturator internus muscle. Superior hypogastric plexus and inferior hypogastric plexus. Superior hypogastric plexus supplies the sympathetic and parasympathetic preganglionic fibers to the viscerals, and inferior hypogastric plexus involves the hypogastric nerve from the superior hypogastric plexus, and it supplies postganglionic sympathetic and parasympathetic nerve supply to the pelvic viscerals. Let's talk about in detail about the blood supply, about the nerve supply of sacral plexus. Its branches are superior gluteal nerve, inferior gluteal nerve, nerve to piriformis, nerve to obturator internus, nerve to quadratus femoris muscle, posterior perforating cutaneous nerve, posterior cutaneous nerve of the thigh, sciatic nerve. Sciatic nerve is the main branch, and it has two parts, tibial part and the common peroneal part, and the last one is pudendal nerve. So superior gluteal nerve supplies gluteus medius, minimus, and tensor fascia lata. And inferior gluteal nerve supplies the gluteus maximus muscle. So this is the most confusing point, and MCQs mostly came regarding these two nerves. Always remember, superior gluteal nerve supplies gluteus medius and minimus muscle, and inferior gluteal nerve supplies gluteus maximus muscle. So other is nerve to piriformis that supplies the piriformis muscle, nerve to obturator internus that supplies the obturator internus and superior gemellus muscles. This is also the important point. Nerve to quadratus femoris muscle also supply the inferior gemellus muscles along with quadratus femoris. Perforating cutaneous nerve supplies skin over the medial aspect of the buttock, and the posterior cutaneous nerve of the thigh supplies the skin over the posterior aspect of the thigh up to the popliteal fossa. Also, it supplies the lower part of the buttock, scrotum, and labium majus. This is the important point, that it also supplies the scrotum and the labium majus in females. Now, sciatic nerve. Sciatic nerve has a main trunk and two other portions, which are tibial and the common peroneal nerve. Sciatic nerve's root values are L4, L5, S1, S2, and M3. It supplies the hamstring muscle, semitendinous, bicep femoris, long head, and adductor magnus. Hamstring part of adductor magnus muscle. While tibial portion supplies the muscles of the posterior compartment of leg, which are gastrocnemius, soleus, plantaris, popliteus, tibialis posterior, flexor digitorum longus, flexor hallucis longus, and it also supplies through the medial and lateral plantar branches to the muscles of the soles of the foot. It has also a cutaneous branch, which is sural branch. It supplies the skin on the lateral side of the leg and foot. This is the important part. Sural nerve supplies the cutaneous supply to the lateral side of the leg and foot, skin to the lateral side of leg and foot, while medial side is supplied by the saphenous nerve. What is common peroneal nerve? Common peroneal nerve is further divided into two parts, deep peroneal branch and the superficial peroneal branch. Common peroneal nerve portion supplies the biceps femoris muscles short head, and through the deep peroneal branch, it supplies the tibialis anterior muscle, extensor hallucis longus, extensor digitorum longus, and peroneus tertius. Common peroneal nerve supplies the anterior compartment of the leg that includes tibialis anterior, extensor hallucis longus, and extensor digitorum longus, and also peroneus tertius, and extensor digitorum brevis muscle. It also supplies the cutaneous supply over the skin, over the cleft between the first and second toes. The superficial peroneal branch supplies the peroneus longus and brevis muscle and the skin over the lower third of the anterior surface of leg and the dorsum of foot. How to remember it? Common peroneal nerve has two branches, deep peroneal nerve and superficial peroneal nerve. Deep peroneal nerve supplies the anterior compartment of the leg, and superficial peroneal nerve supplies the lateral compartment of the leg. So anterior compartment of the leg involves tibialis anterior, extensor hallucis longus, extensor digitorum longus, peroneus tertius, and extensor digitorum brevis muscle, and the nerve supply, cutaneous nerve supply to the cleft between the first and second toe. So this is important point regarding MCQ. Deep peroneal nerve supplies the skin over the cleft between first and second toe, while superficial peroneal nerve supplies the muscles of the lateral compartment of the thigh that includes peroneus longus and brevis, and it also supplies the skin over the lower third of the anterior surface of the leg and dorsum of the foot, except the cleft between first and second toe. This is the most important point. As I told you earlier, pudendal nerve supplies the perineum, so it supplies the muscles of the perineum, external anal sphincter, and it also supplies the mucous membrane of the lower half of the anal canal. Perianal skin of venous scrotum, clitoris, labia majora, and marola. So whole perineum is supplied by the pudendal nerve, and its root values S2, S3, and S4. So guys, is there any query regarding this? So let's talk about the arterial supply of the pelvis. So pelvis is a common iliac artery divided into the two parts, external and internal iliac artery in front of the pelvic inlet. External iliac artery runs on the middle. I'll tell you in the end from where I have taken this. External iliac artery and internal iliac artery. So external iliac artery runs on the medial border of the psoas muscle and gives in three branches. Gives two branches, and one is the continuation. So its branches are inferior epigastric artery, deep circumflex iliac artery, and its continuation is femoral artery. In the it passes beneath the inguinal ligament to form the femoral artery. So common iliac artery divides into the internal and external iliac artery in front of the pelvic brim, while external iliac artery runs on the medial border of the psoas muscle and gives two branches, which are inferior epigastric artery and deep circumflex iliac artery. And it continues as a femoral artery by passing beneath the inguinal ligament. So let's talk about internal iliac artery. This is the main blood supply of the pelvis. Internal iliac artery passes through the pelvic brim into the pelvis, into the true pelvis, and it has two divisions. Let me show you in a picture. You can see here that external iliac is going outside through the pelvic brim, and the internal iliac is passing into the lesser pelvis, and it is divided into two branches, anterior branches and posterior branches. Anterior branch has 9 further branches, and posterior even has 3 branches. So it has two divisions, anterior and posterior. First, talk about the anterior division. It gives rise to the umbilical artery. Umbilical artery gives rise to the superior vesical artery and then obliterated. Superior vesical artery supplies the bladder, and the other branch is inferior vesical artery, which supplies the base of bladder along with prostate. So prostate is supplied by the inferior vesical artery. This is the most important point. Artery to the vas deferens, middle rectal artery, uterine artery that crosses the ureter superiorly. So while doing the hysterectomy, we must be careful about the ureters while tying the uterine artery. Vaginal artery, inferior gluteal artery, obturator artery, and internal pudendal artery. These are the 9 branches. Inferior umbilical artery, which give rise to superior vesical artery, inferior vesical artery, artery to the vas deferens, middle rectal artery, uterine artery, vaginal artery, inferior gluteal artery, obturator artery, and internal pudendal artery. You can see in the diagram. This is the superior vesical artery, below which obturator artery, internal pudendal artery, inferior gluteal artery is the branch of posterior division, vaginal artery, uterine artery, and inferior rectal artery. You can show below medial umbilical ligament. That is the occluded distal part of the umbilical artery. So posterior division of internal iliac artery has 3 branches: iliolumbar artery, lateral sacral artery, and superior gluteal artery. Iliolumbar artery supplies the psoas and iliacus muscle. Lateral sacral artery supply the surrounding viscera of the pelvis, and superior gluteal artery, which leaves the pelvis along with the inferior gluteal artery. So inferior gluteal artery is the branch of anterior divan, while iliac artery. This is an important point. And now let's see the posterior divan, branches of posterior divan, which are the superior gluteal artery, lateral sacral branches, and iliolumbar artery. It has only 3 branches. You can see here more clearly, it has 2 divisions, anterior divan, posterior. Posterior is giving iliolumbar artery, and then anterior divan is giving obturated umbilical artery, that is giving the superior vesical artery, obturator artery, middle rectal artery, uterine artery, artery to the vas deferens, and inferior gluteal artery. Internal pudendal artery is the main branch to the perineum, structures of the perineum. Lymphatics is the most important part, as most of the MCQs came from this topic. First, remember that lymph nodes and vessels are arranged as chains along the main blood supply. So they are named according to the main blood vessel, such as para-aortic lymph nodes, internal iliac lymph nodes, external iliac lymph nodes, and common iliac lymph nodes. So this is the most important point, and the easiest thing is how to remember these lymph nodes according to the name of the blood vessels. For example, if ovaries are supplied by the ovarian artery, which is a branch of aorta, so lymph nodes must be para-aortic lymph nodes. What is perineum? Perineum lies below the pelvic diaphragm, and it is shaped like a diamond. It has boundaries, just like the pelvis. It's anteriorly, it is marked by the pubic symphysis, posteriorly by the tip of coccyx, and laterally by the ischial tuberosities. So perineum is divided into 2 triangles by an imaginary line connecting the 2 ischial tuberosities into 2 triangles. Anteriorly, urogenital triangle that contains the urogenital orifice, and posteriorly anal triangle that contains the anus or anal canal. So its boundaries are anteriorly pubic symphysis, posteriorly tip of coccyx, and laterally ischial tuberosities. And it is divided by an imaginary line passing through the 2 ischial tuberosities into 2 triangles, anteriorly urogenital triangle, posteriorly anal triangle. Anal triangle contains anal canal, and urogenital triangle contains the urogenital orifice. Urethra and vagina in females, while urethra and penile structures in males. This is the picture. These are the 2 triangles and an imaginary line joining the 2 ischial tuberosities. Anteriorly, it is the urogenital triangle, and posteriorly, it is the anal triangle. Urogenital triangle, it is marked anteriorly by the pubic symphysis, posteriorly by the tip of coccyx, and laterally by the ischial tuberosities. What is urogenital diaphragm? It is a musculofacial diaphragm that fills the gap of the pubic arch. As I told you earlier, that pelvic diaphragm is deficient anteriorly. So that gap is filled by the musculofacial diaphragm. And it is formed by the sphincter of urethra and deep transverse perineal muscles. And it is enclosed in the superior and inferior facial layer of urogenital diaphragm. So the inferior layer of this fascia is called the perineal membrane. And perineal body is a mass of fibrous tissue that is attached in the center of the posterior margin of the diaphragm, and it provides attachment and support to the muscles of vagina in females and uterus. There are 2 types of perineal pouches: superficial perineal pouches and deep perineal pouches. And you must remember about the contents that are present in the superficial perineal pouch and deep. So what is superficial perineal pouch? Superficial perineal pouch is a potential space between the membranous layer of the superficial fascia, also called as Foley's fascia, below, and the urogenital diaphragm above. So it is a space present between the membranous layer of superficial fascia or Foley's fascia below and the urogenital diaphragm above. Posteriorly, it is limited by the attachment of membranous fascia to the posterior border of urogenital diaphragm and laterally by the pubic arch. But anteriorly, it is in communication with the space below the superficial fascia of the abdomen. So if any injury occur to the urethra, So urine can go to these places in the abdomen. So superficial perineal pouch boundaries is important. Contents of the superficial perineal pouch are root of penis and its associated muscle, and the root of clitoris in females along with associated muscles. Let's read again about the boundaries of superficial perineal pouch. It is a space between the membranous layer of superficial fascia or Colles fascia below and urogenital diaphragm above, posteriorly limited by the attachment of membranous fascia to the posterior border of urogenital diaphragm, laterally by the pubic arch, but anteriorly it is deficient and it is in communication with the space below the superficial fascia of abdomen. And its contents are root of penis and associated muscles in males, root of clitoris along with associated muscles in females. This is the picture. This is deep perineal pouch and this is superficial perineal pouch. You can see it is continuous. It is deficient anteriorly. Posteriorly, it is limited by the membrane, laterally by the pubic arch. Now, deep perineal pouch. What is deep perineal pouch? Deep perineal pouch is a potential space within the layers of the urogenital diaphragm. Let's see in the picture. You can see this is the urogenital diaphragm. These are the layers, and there's a space. This is the deep perineal pouch. As it is a potential space, so it must contain contents in males and females. This is the important point to remember, and the different contents in males and females. So deep perineal pouch in male contains membranous part of urethra, sphincter urethra, deep transverse perineal muscles, internal pudendal nerve, and dorsal nerve of penis. And the extra point is bulbourethral glands. In males, it contains bulbourethral glands. In females, it contains parts of urethra, parts of vagina, sphincter urethra muscle, deep transverse perineal muscles, internal pudendal nerve, and dorsal nerve of clitoris. So almost all the contents are seen in both except bulbourethral glands, which are present in males only, not in females. Instead, in females, parts of vagina are present. What is anal triangle? So anal triangle is a triangle that is triangular in shape. This is the posterior triangle, and it is separated anteriorly from the urogenital diaphragm by an imaginary line joining the two ischial tuberosities. And posteriorly, it is limited by the tip of coccyx, laterally by the ischial tuberosities. So it contains the anal canal, as the name shows, anal triangle. So it contains the anal canal and its sphincters. So what is anal canal? Anal canal is 4 centimeter in length. This is the important point. Anal canal is 4 centimeter in length, and it is a muscular organ, muscular tube present beneath the pelvic diaphragm, and it is kept in position by the levator ani muscles and involuntary voluntary anal sphincters. There are 2 sphincters that control the anal movements: involuntary sphincter and voluntary sphincter. Involuntary sphincter is also known as internal anal sphincter, and it is formed by the thickened circular muscle layer. While voluntary sphincter, which is external anal sphincter, has 3 parts, which are subcutaneous, superficial, and deep parts. You just have to remember the names only. So anal canal has 2 sphincters, involuntary and voluntary. Involuntary is also called internal anal sphincter, which is thickened circular muscle layer, while voluntary is external anal sphincter and divided into 3 parts: subcutaneous, superficial, and deep. This is a picture. You can see in the picture parts of external anal sphincter and internal anal sphincter. Before talking about the female genital organs, we'll talk about the structures. Okay, let's talk about the branches that leaves the pelvis through greater sciatic foramen. And this is the most important point you must remember about these, and the MCQs come from these. So the branches that leaves the pelvis through greater sciatic foramen are sciatic nerve, superior gluteal nerve, inferior gluteal nerve and vessels, nerve to quadratus femoris muscle, nerve to obturator internus muscle, and posterior cutaneous nerve of the thigh. Total 6 points: sciatic nerve, superior and inferior gluteal nerve and vessels, nerve to quadratus femoris muscle, nerve to obturator internus muscle, and the posterior cutaneous nerve of the thigh. Now let's talk about the female genital organs, which are ovaries, uterus, and vagina. Ovary is attached to the back of the broad ligament by mesoovarian, and ovarian vessels and nerves enter the ovary at the ovarian hilum. And ovary is covered by a peritoneum, modified peritoneum, that is called germinal epithelium, and beneath germinal epithelium is tunica albuginea. So ovary has two parts, outer cortex and inner medulla. Ovarian follicles are embedded in the cortex. So ovary lies in the ovarian fossa that is present on the lateral wall of the pelvis. And the ovarian fossa is bounded by external and internal iliac arteries. So ovary lies in the ovarian fossa in the lateral wall of the pelvis and bounded by external and internal iliac arteries. Ligaments of ovaries. There are two ligaments of ovaries, suspensory ligament and round ligament, that supports the ovaries in its place. Suspensory ligament is the lateral part of the broad ligament that connects the mesoovarian to the lateral pelvic wall. It also contains the blood vessels and lymphatic vessels and nerve supply of the ovary. It is the lateral part of broad ligament connecting the mesoovarian to the lateral pelvic wall. What is round ligament? Round ligament of the ovary is the remain of upper part of gubernaculum, while round ligament of the uterus is the remains of lower part of the gubernaculum. So round ligament of the ovary is the remain of upper part, and it extends from the medial margin of the ovary to the lateral wall of the uterus. Note that the round ligament of the uterus is the lower part of gubernaculum. Blood supply. Ovaries are supplied by the ovarian artery, which is a branch of the abdominal aorta. And the ovaries are drained by the ovarian veins. Right ovarian vein drain into the inferior vena cava, and left ovarian vein drain into the left renal vein. This is the important point to remember. Left ovarian vein drain into the left renal vein, while right ovarian vein drain into the inferior vena cava. Lymphatic drainage, as I told you, lymphatic drainage is the same as that of the arterial supply. So lymph drains into the para-aortic lymph nodes at the level of first lumbar vertebra. And the nerve supplies through the aortic plexus. Uterine tubes. There are two uterine tubes. Each tube lies on the upper border of the broad ligament of the uterus. Uterine tube connects the peritoneal cavity to the uterine cavity, and it has four parts: infundibulum, ampulla, isthmus, and intramural part. Infundibulum is the lateral part, and it is funnel-shaped that contains finger-like processes that are called fimbriae. These are draped over the ovary. While ampulla is the widest part of the tube, and fertilization occur in this part. This is important. Fertilization of egg occur in the ampulla of the uterine tube. Isthmus is the narrowest part of the tube and lies lateral to the uterus, while intramural part is the segment that pierces the uterine wall. So it has four parts, and fertilization occur into the ampulla. And uterine tube also provides nourishment and fertilization of the ovum and transports the ovum to the cavity of the uterus. Blood supply of uterine tubes. It is supplied by the uterine artery and ovarian artery, and drain into the uterine and ovarian vein. And the lymphatic vessels are follow the arteries and drain into the internal iliac vein and internal iliac lymph nodes and para-aortic lymph nodes. Uterine artery is a branch of internal iliac artery, so these also drain into the internal iliac lymph nodes and para-aortic lymph nodes. Nerve supply is the sympathetic and parasympathetic nerve supply from superior and inferior hypogastric plexus. Uterus. Uterus is divided into three parts: fundus, body, and the cervix. Fundus lies above the entrance of the uterine tube. Body lies beneath the entrance of the uterine tube above, and it narrows down below and becomes continuous with the cervix. Cervix pierces the interior wall of the vagina, and the cavity of the cervix is called cervical canal. It communicates with the cavity of the uterus through internal os and with the cavity of the vagina through external os. So uterus has three parts: fundus, body, and cervix. Fundus is above the uterine tubes, body is below the uterine tubes, and below it continues with the cervix. And the cavity of the cervix is called cervical canal, and it communicates with the uterus through internal os and with the vagina through external os. There are two positions of the uterus that keep the uterus in its position: anteversion and anteflexion. Anteversion is the forward bending of the uterus on the long axis of vagina, while anteflexion is the bending of the body of the uterus over the cervix. So anteversion is the forward bending of the uterus on the long axis of vagina, while anteflexion is the forward bending of the body of the uterus on the cervix. Supports of the uterus. This is important. A uterus is supported by these structures: pelvic diaphragm, perineal body, transverse cervical ligament or cardinal ligament, pubocervical ligament, and sacrocervical ligament. Five structures that support the uterus: pelvic diaphragm, perineal body, transverse cervical or cardinal ligament, pubocervical ligament, and sacrocervical ligament. These ligaments also support the cervix and vagina. What is broad ligament? Broad ligament is a two-layered fold of peritoneum and that extends from the lateral margin of the uterus to the lateral pelvic wall. And broad ligament contains the uterine tube in its upper free bordered round ligament of the ovary and the uterus, and the uterine and ovarian blood vessels, lymph vessels, and nerves. But broad ligament doesn't provide any support or little support to the uterus. What is round ligament of the uterus? As I told you earlier, round ligament of the uterus is the remain of the lower part of the gubernaculum, and it extends from the superolateral angle of the uterus. Superolateral angle of the uterus passes through the inguinal canal to the subcutaneous tissue of the labia majus. It assists in keeping the uterus anteverted and anteflexed. Blood supply of the uterus. The uterine artery from the internal iliac artery and the ovarian artery supply the uterus. Uterine artery is a branch of anterior deviation of the internal iliac artery. Veins drain to the uterine vein and the ovarian vein. Lymphatic drainage. This is important. From the fundus, lymph vessels drain to the ovarian follow the ovarian artery and drain into the para-aortic lymph nodes. And from the body and cervix, lymph vessels drain into the internal and external iliac lymph nodes, while few lymph vessels also passes through the inguinal canal to the superficial inguinal lymph nodes. So fundus of the uterus drain into the para-aortic lymph nodes, body and cervix drain into the internal and external iliac lymph nodes, and the lower part of the cervix also drains into the superficial inguinal lymph nodes. Nerve supply of uterus. Sympathetic and parasympathetic nerves from the inferior hypogastric plexus supply the uterus. All the pelvic structures are supplied by the sympathetic and parasympathetic nerve fibers from the inferior and superior hypogastric plexus. Vagina. Vagina is the female genital canal and it serves as the excretory duct for menstrual flow, and it forms a part of the birth canal. So what is vagina? Vagina is a vascular tube that extends between the vulva below and the uterus above. The cervix of the uterus pierces the anterior wall of vagina, and a vagina has an orifice in the virgins that possess a thin mucosal fold that is called hymen. Hymen is perforated at its center. The area of the vaginal lumen that surrounds the cervix of the uterus is divided into four regions or four fornices, which are the anterior fornix, posterior fornix, right lateral, and left lateral fornices. The upper half of the vagina lies within the pelvis between the bladder anteriorly and the rectum posteriorly, and the lower half of the vagina lies within the perineum between the urethra anteriorly and the anal canal posteriorly. So, vagina, the cervix of the uterus pierces its anterior wall. It has an orifice that possesses a thin mucosal fold that is hymen, and the area of the vaginal lumen that surrounds the cervix of the uterus is divided into four regions or four fornices: anterior, posterior, right, and left lateral. And the upper half of vagina lies within the pelvis, in the bladder anteriorly and the rectum posteriorly, and the lower half of the vagina lies in the perineum between the urethra anteriorly and the anal canal posteriorly. Now, what structures support the vagina? Vagina has three parts: upper third, middle third, and lower third. Upper third is supported by levator ani, transverse cervical ligament, pubocervical, and sacrocervical ligament, the same ligaments that support the uterus. Middle third is supported by the urogenital diaphragm, and the lower third is supported by the perineal body. So these structures support the vagina. What is the blood supply of vagina? Arteries are the vaginal artery, which is a branch of anterior deviation of internal iliac artery, and the vaginal branch of uterine artery supply the vagina, and the vein drain into the vaginal vein, which further drain into the internal iliac veins. What is the lymph drainage? The upper third of the vagina drains into the internal and external iliac lymph nodes. Middle third drains into the internal iliac lymph nodes, and lower third drains into the superficial inguinal lymph nodes. Divide vagina into three parts. Upper third drains into the internal and external iliac lymph nodes. Middle third drains into the internal iliac lymph nodes, and the lower third drains into the superficial inguinal lymph nodes. Nerve supply. Inferior hypogastric plexus supply the vagina. Almost all structures are supplied by the hypogastric plexus in the pelvis. This is the diagram of uterus and ovaries. This is the fundus of the uterus, body of uterus and cervix. Internal os, external os. This is the ovary. Infundibulum, ampulla, isthmus, and intramural part of the uterine tube. It's the broad ligament of uterus. Now, let's talk about the male external genitalia. Male external genitalia is penis. Penis has two parts. It has a cylindrical body that hangs freely and a fixed root. So the body of the penis is has an expanded distal end that is called glans penis. As you can see in the picture, this is glans penis. The body has an expanded distal end called glans penis. And the prepuce or foreskin is a hood-like fold of skin that covers the glans. So interior of the penis, anatomy of penis is important regarding the MCQs. The interior of the penile body is composed of three cylinders of erectile tissues that are enclosed in a tubular sheath of fascia. These are composed of two dorsally placed corpus cavernosum and a single corpus spongiosum to the ventral surface. See in the picture, this is corpus cavernosum and this is corpus spongiosum. Laterally, this is corpus cavernosum, and in the middle or ventral surface, corpus spongiosum. And the penile urethra is passing through the corpus spongiosum. So, interior of the penile body is composed of three cylinders of erectile tissues that are enclosed in a tubular sheath of fascia, and this fascia is called Buck's fascia. Erectile tissue is composed of two dorsally placed corpus cavernosum and a single ventrally placed corpus spongiosum, and the penile urethra passes through the corpus spongiosum. At its distal end, the corpus spongiosum expands to form the glans penis, which covers the distal end of the corpus cavernosum. As you can see in the picture, it is covering the distal portion of the corpus cavernosum. This is the prepuce or foreskin, and this is glans penis. So the penile part of the urethra runs through the center of the corpus spongiosum and opens onto the surface of the glans at the external urethral meatus. So move to the root of the penis. The root of the penis is located in the superficial perineal pouch. And it also composed of three muscles of erectile tissues that consist of the bulb of the penis, the right and the left crus of the penis. You can see here the root of the penis contains the bulb and the two crura. This is bulbospongiosis and the two crus. The bulb is located in the midline and is traversed by the urethra and is covered on its outer surface by bulbospongiosis muscles. Each crus is attached to the side of the pubic arch and is covered on its outer surface by the ischio-cavernous muscles. So bulb of the penis is continuous anteriorly with the corpus spongiosum, and the two crura are continuous anteriorly with the corpus cavernosum in the body of the penis. As seen, the penis in the middle is the bulb of the penis, and on the lateral sides are the two crusts of the penis that are attached to the subpubic arch. So The bulb is located in the midline and traversed by the urethra, and it's covered by the bulbospongiosus muscle. As shown in the picture, these are the bulbospongiosus muscles. And each crust is attached to the side of the pubic arch and is covered on its outer surface by ischio-cavernous muscle. So bulb is continuous with the corpus spongiosum, and the two pleura are continuous with the corpus cavernosum. Blood supply of penis is important. It is supplied by the deep arteries of the penis, and the branches of dorsal artery of the penis supply the area that is the branch of pudendal nerve, and runs drain into the deep dorsal vein. Deep artery of the penis and dorsal branch of the dorsal artery of the penis, that is branch of pudendal artery, and veins drain into the deep dorsal vein. Lymphatic drainage. Lymphatic drainage may in glans penis drain into the deep inguinal and external iliac lymph nodes. Glans penis lymphatic drainage is most important according to exam point of view. Glans penis drains into the deep inguinal lymph node and external iliac lymph nodes, and the skin of the remainder organ drains into the superficial lymph nodes and the external iliac lymph nodes. So this is the end of the topic. Is there any query regarding the topic? You can ask any questions. Is there any question? Okay, this is the course. You can join this course, and there's 50% off for the students who couldn't make it in the last exam, and they can also appear in the next course on the 50% off. If there is any question regarding the topic, you can ask. Okay, thank you so much for today's lecture.